Hello, good afternoon. My name is Bianca and I'm the nurse that's going to be performing your physical assessment today. Before we go ahead and get started, I want to verify with you that it's okay that we do this assessment on you.
Yes.
And if you can also verify your first and last name and your date of birth for me.
Jacqueline Figueroa, June 21st, 1966.
Very good. And also, if I can just check your wristband to make sure that's the correct name and date of birth. Very good. Now, before I get started, I want to go ahead and wash my hands as well as provide privacy for you, okay?
Go ahead, wash my hands.
And provide for privacy. Okay. So first I'm going to just be assessing and inspecting your, I'm going to be inspecting your thoracic cavity in posterior and anteriorly. Just looking to see if I know any masses or lesions, as well as on the back side, and I don't notice any masses or lesions anywhere in that areas. I'm going to then go ahead and auscultate or listen to your lung sounds anteriorly, and then we'll go ahead and listen on the posterior side of your back. Okay?
Yes.
I'm first going to start on the anterior side and listen to your bronchial. So if you can just take a deep breath in and out for me. And a deep breath in and out. Very good. And deep breath. Deep breath. Deep breath. And you can lift up your shirt for me. Good. And deep breath. And deep breath. Very good. So on the front side, you have clear bronchiovesicular sounds, as well as your bronchial sounds clear and normal. I'm not hearing any wheezes, crackles, or rhonchi, which would be abnormal findings that we would hear when listening to the lungs. I'm going to go ahead and go forward with your posterior side. Very good. If you can turn to your side. And you can breathe deeply again for me. In and out. Good. Again. Again. Very good. And so, anterior to posterior, both of your sounds on your lungs are clear, with no wheezing, no crackles, and no any abnormal findings that I can hear, which is great. We're going to then go ahead and identify and palpate some areas that are some landmarks that we use when looking at your chest.
Okay.
I'm going to be looking for the suprasternal notch, which is kind of this divot you have right here in the front of your neck. And then I will go down. I'm going to move your necklace a little bit to the side. We'll go down to here where the sternum is. And then just below the sternum will be the sternal angle, also known as the circle of Lewis, where kind of all of your ribs meet. And then below that will be the costal angle in between the breasts there. And in people that have emphysema, it will typically be a larger widened angle, which is a sign of hyperinflation of the lungs. You do not have that. All of your findings are normal and accurate. We're going to then go ahead and look at the posterior side. If I can have you turn. And I'm going to identify some landmarks here that we have, which will be your T1, which is right about here. If you can actually angle a little bit more, there we go. You have your T1 and your C7, which is where the bottom of your neck and the top of your thoracic cavity meet. And if I kind of follow that all the way down, I'm going to lift up your shirt if I can. And then following all the way down your spine, and I'm not noting any lordosis, kyphosis, or scoliosis, which would be any abnormal curvatures of the spine. After I've gone ahead and done that, I'm going to do percussion, which I will be percussing and listen and tapping against my finger to hear and see if we know any abnormal findings, which they're normal. On the front side, if we can do the same thing, please. And both those findings are normal on the posterior and anterior sides. We're then going to do some tactile femoritis, which is where we detect when you speak and you have vocal resonance in what you are saying. We're going to be testing your bronchoscopy, your ecoscopy, and your whispered pectriloquy. So for the first one, bronchoscopy, we're going to be having you say the word 99. And I will first touch when you are saying those, in those areas of the chest, and to detect if I can feel the resonance that's occurring. Okay? And you can say 99.
99. 99. 99. 99. 99. 99.
And then if you can turn posteriorly, and if we can do the same.
99. 99. 99. 99. 99. 99.
And next, can I have you say and continue to say or express the letter E?
E. 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 E.
And we'll also then, while we're on the back side, if I can have you do the whispering petriloquy and doing 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
And then I'm going to also listen, so we'll be doing the same set of 99, 1, 2, 3, and the E while I listen and auscultate. Go ahead. 99.
99. 99. 99. 99. 99. 99.
And 1, 2, 3.
1, 2, 3. 1, 2, 3.
Whisper.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
And then last we'll do the E.
E. E. E. E. E. E.
Very good. And then I'll have you go ahead and go over to the front, and we're going to finish off the rest of those on the front side. So we have done the 99 on the front side. If I can also have you do the 1, 2, 3 and the E while I'm palpating and touching, and then we'll listen with all three of those vocal resonances that we're looking at. And if you can go ahead with 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Very good. And then we'll do E.
E. E. E. E. E. E.
Okay, and then listening, we're going to do 99 first, 1, 2, 3, and then the E.
99. 99. 99. 99. 99. 99.
And
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
and E, and if you can hold the E.
E. E. E. E. E. E.
Very good. Okay. And then if I can also take a look at your hands, just to note if you're having any clubbing of the hands or feet, and for from what I can see, I see no clubbing, which would be a sign of somebody in a COPD patient that they're having difficulty with perfusing as well as oxygenating. Another thing that I'm going to be looking overall is how her breathing is, which she has some coastal breathing opposed to the diaphragmatic breathing. So she's kind of breathing up and down as opposed to forward and back, where you're using more of your diaphragm. I also note that her respirations are unlabored. She is not having any nasal flaring, any retractions of the chest, or any respiratory distress from what I can see in her normal respirations. All of her findings that I've listened to, as well as all of the palpations and percussions that I've done, have been found as normal. We're now going to go ahead and move on to the cardiovascular portion of the assessment. So when looking at the cardiovascular system, I'm going to be first listening to your apical heart rate, which is found at the mid-clavicular region of the chest. And if I can go ahead, I'm going to listen right about there. And you listen for about 1 minute to get a good detection of how your heart is beating. And your heartbeat is regular with 2+ quality, and I can note the S1 and S2 sounds in your heart. We're now going ahead and trying to identify some areas that we look at when we're assessing the cardiovascular system. One of those would be the carotid areas of the neck, and I would be looking for any palpitations or increased bounding kind of pulses that I would be able to note by just visualizing, which I see none, no palpitations anywhere on the chest, in the pericardial area of the heart, as well as also the carotid. I'm not seeing any venous jugular distension, which is very good. I'm then going to take a listen at your carotids separately, as well as palpate them after. And I'm going to be listening for a bruit. And then I will palpate those carotids separately and listen and feel for the throat. Okay, very good. And good on the other side as well. Some other landmarks that we're going to look at is the different valves that can be found in the heart. You'll be able to actually listen to them when you put your stethoscope to certain regions on the chest. I'm going to first take a listen to the pericardial area of the heart, which will be here on the left side of the sternum. I will then listen to the aortic, which is on the right area of the sternum. Very good. I'm going to then go ahead and listen and notify the mitral, which is the lowest and maximum point of the heart. Good. I'm then going to go ahead and listen to the pulmonic. The tricuspid. In the Erb's point. And all those are noted and normal. Another aspect of the cardiovascular system will be the peripheral perfusion to the lower and upper extremities, as well as detecting those peripheral pulses. So if I can go ahead, I want to take a look at your arms, and I don't notice any peripheral edema in the upper extremities, which is very good. And if you can turn to the side for me, and lift your legs up towards the couch. Thank you. So I can go ahead and take a look at your lower extremities. And from what I'm noting and visualizing, I see no peripheral edema in the lower extremities. I'm going to go ahead first, before I go ahead and touch your feet, if I can take a listen and feel to your radial pulses, which are equal to 2+ quality. I'm then going to move up to your brachial, and they have 2+ quality as well, and are equal bilaterally. I will then go on to look at your legs. If you can lift up your knees a little for me. Very good. I'll be looking at your popliteal pulses, which are just behind the knee. Good. They're equal to 2+ quality. I'm going to then go on to your posterior tibial pulses, and they are equal to 2+ quality. And then I'll take a feel with your pedal pulses, and they are equal to 2+ quality. I'm then going to go ahead and wash my hands again. And then the last thing that we want to look at is if you can turn to me and give me your your wrist. I'm going to go ahead and perform an Allen's test, and an Allen's test will detect the circulation that occurs between the radial and ulnar arteries to your hand. And if you can do me the favor of closing your hand, and we're going to keep that hand closed for about 30 seconds, and I will then go ahead and palpate right at your radial and ulnar pulses. And when I tell you to, if you can release your hand, go ahead and release your hand. I'm going to let go, and we get nice pink perfusion back to the hand. So that was a good positive Allen's test. You have great circulation. Your lung sounds were great, sounded good. That will conclude my assessment for today. Is there anything else that I can do for you, Ms. Figueroa?
Thank you, Nurse Hampson.
Thank you. You have a lovely day.
Thank you.